how to reduce post-injection pain.
And if this is your first time here, make sure to subscribe so you can learn more about fitness and nutrition, hormones and anti-aging, all this to optimize your life overall. And hit that notification bell so you don't miss anything.
Post-injection pain. I recall when I started doing sub-Q and I would just do the injection and that was it. The sensation would kind of last for a lot longer, like a couple of days. I don't even know if I would call it pain, but just a little discomfort, like something that's off, a little sore. Now that I started, it's been quite some time I've been doing this, but since I've been injecting, and as soon as I take it out, like I said, I'll put the palm of my hand and I just press and I massage that oil so that it disperses into the fat. I don't wind up with all of the oil all in one spot so that it causes an issue at that one spot. I'm just kind of almost kneading it into my skin so it just disperses as much as possible. That'll avoid that type of pain. You can do the same thing with IM. You know, don't just necessarily just inject and pull out and leave. If you're saying, well, every time I do that, I have pain, you know, try to do that and try to massage that whole area so that the oil disperses. The more it'll disperse, the less pain, localized pain you'll have at the injection site. That's pretty much the only thing I can think of.
And some guys talk about a bit of inflammation, redness that lasts for several days. Anything that can be done about that?
Yeah, either it's I would say a sensitivity to the oil, or it's just too much oil all at once. You know, you're maybe injecting a half an ml, or you know, maybe you're doing once a week and you're doing the whole thing, and it's just a lot of oil all bunched up in one spot. I would just say try to just, you know, take 20-30 seconds and just kind of massage the whole thing around. Use your fingers and just imagine, you know, that oil underneath the layer of the skin just smoothing out everywhere. And it won't. When a friend of mine asked me to do IM and I did my delt the other day, I managed to do one injection and I massaged it. And when I went to sleep that night, and I sleep on my side, I could feel it. I could feel the discomfort. It wasn't pain that's going to, you know, keep me awake at night, but I could feel that discomfort even the next day, even after I had massaged it. And this was a very, very small dose. When I do it sub-Q, I mean, I just don't get those issues at all. So if you're finding yourself doing IM and you're getting pain, just move to sub-Q. You're rarely going to have issues, and if you do, it's going to be a tiny little bump that goes away in a day or two. You don't see it.
Okay.
The more frequent you do these injections, the smaller the dose that you're giving yourself at any one time, the less amount of issues that you will have.